Hi,
So,
David. It is so nice to be interviewing you. You're one of my favorite people, and I'm looking forward to hearing from you on some of the questions that I've proposed. And you have your wonderful biography on the NCAP site, so people will have a lot of reading to do to understand all the terrific work that you've contributed to our field. But I often, when I'm introduced, I feel like people are focused on what they feel stands out. And sometimes I'd like to say, no, wait a minute, this is what I really want people to know. So, what kinds of things, since people are going to have access to your biography, what 5 things would you like the people listening to this interview, would you like to stand out and share to begin this process?
well, first of all, thank you for inviting me to take part in this project. You were one of my favorite people too, Sharon. Um, I've known you for many, many years, as you've pointed out, going back, I think, to your time at Kinship Center. Anyway, thank you for, again, for asking me to focus on some of the things that I think I'd like people to know about me. When I first got involved in this field in the late 70s, there were relatively few psychologists doing research in this area, or at least developmental psychologists. There were psychiatrists, there were some clinical psychologists, but very few developmental psychologists. And so when I got involved in this work, I got involved really as someone who was interested in children's cognitive development. And I started doing work on how adoption impacted children, the meaning that they came to give to their adoptive status, how they came to understand what it meant to be adopted. And that was seminal work at the time. No one else had been doing that work. And so it was something that I think was an early contribution that I think has made a difference, not just in terms of research questions that people have looked at, but also in terms of its application to helping parents to share with their children information about their adoption story. So that's one of the things that I think I'd like people to know. The second thing is that, as a professional, I'm both a researcher and a clinician. I was cross-trained. And I think that has really helped me in many ways. Many of the ideas and the conclusions that derived from my research and from the research of others, of course, were readily adapted in my clinical work with children. And conversely, many of the insights that I gained from my clinical work were then translated back into ideas to pursue in research. So there was a cross-fertilization in terms of my research approach to this topic, as well as my clinical approach. And I think there are certainly others who are both clinicians and researchers in the field, and I think they probably would share a similar idea that the different ways of looking at adoption, fertilize each other in very productive ways. So that's a second thing I'd like people to know about my work. A third thing, though, is that I'm not just a research and clinical psychologist, I'm also a forensic psychologist. Forensic psychology is the application of mental health issues to the law. And over the past 35 years, I've been applying psychological research and theory in the area of adoption and foster care to legal settings as an expert witness, mostly in family law cases and in juvenile dependency cases, but in other areas as well. And that's been a very interesting part of my professional development. I wasn't trained really as a forensic psychologist. No one in my cohort really was trained as a forensic psychologist. There were no PhD programs in it at that time, maybe one, I think, at University of Nebraska. But over the years, through continuing ed, through other kinds of training, I learned what a forensic psychologist was and learned how to apply my interest in adoption and foster care to issues that got raised in legal settings about adoption, foster care, custody, and related family law matters. One of the areas that I'm most proud of, and it's related to what I just talked about, though, is my work around LGBT family issues. I was an expert witness in the first gay marriage trial that took place in Hawaii in the mid 1990s. Actually, that case was the case was won by the plaintiffs. The court ruled in favor of gay and lesbian adoption, but the state of Hawaii basically overturned that ruling by I won't go into the specifics, but they overturned it. And so there continued to be a lot of problems, for individuals who wanted to marry or who wanted to adopt or foster. I've worked closely with the ACLU and Lambda Legal, as well as a number of other LGBT advocacy groups over the years, mostly in the area of legal challenges to marriage, adoption, and fostering by LGBT individuals.
That leads me actually to a question that's broader. You're not just an incredibly talented clinician and researcher. You're a person who has a great sense of humor. You're a great family man. Tell me and the audience that's listening to this, what do you like outside of the work that you do? What are some of your other passions in life?
Well, I'm going to start with my wonderful family. That is my passion. It is the center of my life, more so than my career, of course. I have a wonderful wife. We have wonderful children, 6 grandchildren, I was going to say most in California, but they're no longer most in California. They go from Hawaii, my oldest grandson, who just got married in Hawaii, all the way to my biological daughter and her family with the youngest grandson back in New Jersey. The rest up and down the West Coast. They are my passion. They are the focus of so much of my life. But second, I'm a potter and had been for over 35 years. I spend as much time as possible at a local pottery studio, making a range of functional ceramic pots. Mostly I give them away to family and friends. They are they know that there come birthdays and holidays, and just out of the blue, they're going to get something from me. It's been an important part of my life for quite a while. As I said, it's a source of, I would call it meditation, really. When I throw pots on the wheel, I often close my eyes, and it's all by feel, at least a good part of it, and it's very meditative. It's great for stress reduction. So it's one of the creative areas of my life. I'm an avid reader. I enjoy a range of genres, fictional, non-fictional. I have a secret passion, if you will, for fictional police procedurals. I call them my airplane books. Read them, on airplanes often. So the last point I want to say about who I am and so forth has to do with, I think I mentioned this earlier, my love of real estate and Ann's love of real estate. We have lived together since 1982, and over those years we've lived in, owned 7 different houses.
Wow.
And as I mentioned, we're planning on moving maybe next year in the spring to LA. So that will be our 8th house. Maybe not our last, for all we know. Our children have a running joke that, come 6-7 years or so in any one house, and they say, okay, are they getting ready to move again? So that's been our history together. It's a love for nest building, as Ann calls it.
So, I am retiring. I'll be 80, and I decided it was time to devote my interests in other avenues. And I have thought a lot about legacy. And so I wanted to ask you, what would you like people to say about you? In a sense, what would be in the eulogy about David as a professional? What would you want them to say?
Well, that's an interesting question. I thought about that. Some of what I've already shared would be, related to that question. I think, it's really that I've loved the work I've done. I've been committed to the families that I've met, and I've been committed to the people I've worked with, not just as a researcher, but as a clinician. And it was a privilege to work with them. It was a privilege to work with my students, my undergraduates and graduate students. I was at Rutgers for 32 years and loved my time there. It was just time to move beyond academics and move out to California back in 2006. You asked about what I would like to have as a professional gravestone saying, and it made me think a little bit about my first book, Being Adopted, The Lifelong Search for Self. And I think on there I would like it to say something along the lines of, the search for self is never over. Should it be?
That gives hope for growth.
That's right. That's right. We should never stop growing. We should never stop searching. We can never know enough about ourselves. There's always that next mystery to be uncovered, and it's what makes life exciting.
David, do you feel that you have left people in your footsteps? I mean, you've had a lot of students and so on. Are there folks following you that you feel like, okay, they're going to pick up and build on my shoulders? I feel like they are following my example of my work and building on it. I feel that way about Allison, our NCAP leader with Adam. Do you feel like you've left that legacy as well?
Well, I have in some ways, and in other ways, there's been a little bit of a disappointment. None of the graduate students who went on as careers in psychology have pursued adoption as an area of research. They've made some important contributions in other areas, particularly in abuse and neglect. I've got a couple of people who are fairly well known in that field, and I think I got them started in fostering some interest in that area, because they worked with me, they trained with me, both as researchers and as clinicians, in a foster care counseling project, which I ran for the state through a program at Rutgers. And that work was working with kids who had been in the system, who had been neglected, who had been abused. And it's what triggered their interest in neglect and abuse. They didn't continue, per se, doing research in fostering or adoption. So in that regard, that's been a little bit of a disappointment, although I don't fault them at all. Now, on the other hand, as clinicians, I've trained many, many clinicians, and I know I've kept in touch with a reasonable number of them. Many of them work in the area of child welfare, the interface between mental health and child welfare, which is ever since I've been involved in adoption, has been an interest of mine. Most clinicians don't get training in the area of adoption and foster care, as I think you know. And so it often means that they don't understand the dynamics that these children experience and the families experience as they're raising these kids. And I think there's a legacy there that I've left with these clinicians who went into the field perhaps better prepared than the average clinicians to meet the challenges, to respond to the challenges in a way that benefited the families that they've worked with.
That's well said. That statement is a powerful statement. So, I certainly thank you on behalf of all the families out there and adult adopted people and birth first family members who are looking for clinicians that have sensitivity to those issues. So the folks that are listening, you have so much that you could teach, and you teach on so many wonderful topics. But if you had to take a moment here to talk about a few things you want people to leave this interview understanding and knowing from your clinical work and your research, what would the lessons be that you want them to remember when they are finished watching this legacy video?
This turned out to be an easy question for me. I think that because I've talked about this with parents I've talked about this at conferences and talked about it with the families that I've worked with clinically. Perhaps the most important thing that parents can take away from this, or clinicians who work with families can take away from my work, is the importance and the art of listening to their children, to children. Parents are quick to give advice. They are great advice givers. They're great at offering guidance, but they're often not good listeners. And the reason is they often are experiencing their children hurting. Their children are in pain and they want to make that pain go away as quick as possible. So they offer advice, they tell the children what to do. But to truly help kids, parents must be patient. They must take the time to withhold their answers as they listen to what their children are going through. It's difficult, as I said, because their children are going through a lot. They're hurting, perhaps, emotionally. But parents must understand that it's most helpful and most respectful. The most helpful and respectful thing they can do is to bear witness to their children's emotional pain. Because by doing so, they validate, they normalize their children's feelings, and they are then able to offer the type of support that is the beginning, not the end, but the beginning of the healing process for their children.
Well, that brought tears to my eyes. Thank you. That's a powerful message, lesson to leave for the clinicians and the family members watching this video. Lastly, NCAP uses 3 words on its website: connect, strengthen, and empower. As an NCAP team member, what do you hope this team can accomplish over time related to that vision?
Well, I've talked with Adam about this a lot, especially as he was developing NCAP and developing his mission statement. I was, as you know, one of the early people involved in NCAP as a consultant. It's my hope that NCAP and the team can offer, the wisdom, the guidance, the creativity, the support that truly foster stronger, healthier, more stable adoptive and foster families. I know NCAP isn't just about promoting stable families. Stable families that don't have the support that they need become unstable families. It's NCAP's goal to facilitate the type of support that ensures that families are healthy. And they'll be healthy by ensuring that there are available and affordable post-adoption services, services that provide adoption-competent mental health and child welfare types of services. And as I said before, too often when families are in need of these kinds of services, they have difficulty finding them. They don't have difficulty finding clinical services. They have difficulty finding clinical services in which the clinicians have the experience and the expertise to truly understand what the families have gone through and are going through. We know from some research now that too many families, adoptive and foster families, encounter mental health people that sometimes make things worse, blaming the families for the children's problems, telling the families to just send the child back to the agency as if they can do that, easily, or that they want to. So I think, NCAP as an organization promoting not just stability, but health, empowerment of families to advocate for their children, empowering professionals to develop and facilitate and promote adoption clinical competence is a real important goal.
David, as always, it's a very powerful experience to listen to you. I wonder, do you have anything else you'd like to add that I didn't ask you about that you feel would be important or not?
I just want to say one thing, and it's to my colleagues around the world, here in the United States and abroad. It's been a real privilege to meet you, to work with you, so many bright, creative, empathic, motivated people in child welfare, in the mental health field, researchers, clinicians, consultants, advocates, teachers, some scholars, some just working in the trenches of the clinical work field or in child welfare. It's been a privilege working with you, and you've enriched my life. I hope I've added something to your professional lives and to the families you work with. But it's been a privilege getting to know all of you.
What a lovely final statement. Thank you for the privilege of doing the interview with you, David.
It's been a privilege on my part too.
Thank you.